All right. Hi, everyone. It's Stephanie again with the patient story, and we're welcoming back Dennis, who, again, just went through the first symptoms, the first test, including that biopsy, and now we're getting into what happens after you make your treatment decision. So, Dennis, you just explained you decided, let's go surgery because that leaves more options open, it seems like, on the table. Radiation was possible after if you needed it. What was the preparation going into surgery, if anything?
Well, the preparation at that particular point in time was to allow my body to heal after the biopsy. And they felt that that took several months to do it. So I had the biopsy in January, and it wasn't until April 15th that they decided to do the surgery. I arrived at the hospital early in the morning. They told me at that particular point that you had to do a bowel prep and all of that. Today, that's no longer required at this hospital. So we did the bowel prep. We went through all of that and got into the hospital. And I got there, I think at 7 o'clock in the morning. And then somewhere at around 4 in the afternoon, they decided to do the surgery. So it was a long wait.
Oh,
And finally got in. It was 5 hours, 5.5 hours worth of surgery. And what I didn't realize is that when the surgery is done, you are tipped. Your entire body is inclined at about a 45-degree angle, head down, so that they can get into where they need to get into. So somewhere around 10 o'clock at night, I was back in my room. I had spoken to my wife, who said, the doctor said they got everything. It looked like everything was contained, and they were very pleased with the results of that. So somewhere around 2 o'clock in the morning, the nurse came in to, of course, take your temperature and do the things that nurses do at 2 in the morning to wake you up. And she said, at some point, if you want to take a walk, let us know. And I said, how about now? And she said, okay. So at 2 o'clock in the morning, I took my stand with my IV and the nurse, and we started walking down the hallway. And she said, whatever you do, don't look down because you'll get dizzy. Now, being a guy, what did I do? I looked down. That was not a good idea. So I got a little faint and was able to hold on and made it, but then walked around pretty well. After that, got back in bed. I guess did fall asleep at one point, and the doctor came in the next morning at about 10 o'clock and said, well, it looks like you can go home. And it was like, you got to be kidding me. I mean, I have drains hanging off the side of me. I'm hooked up with IVs. And even though they said it was overnight, psychologically, you're not prepared for that.
right.
And so they got the drain out, which was an exciting experience.
Oh,
And,
gosh.
and it's a drain in your side. And so they pull that out, and you can feel that whole thing unravel as this thing comes out. You're, of course, hooked up with a catheter. So you've got all that going on. And then drove home. And it took us about a half an hour to get home. And what I would recommend to you, the guys, if you're hooked up with a cat and you have that urine bag attached to that, my suggestion is use the larger bag. Don't use the one that's on your leg, because sitting in a car, you can get some backflow, which is not good.
Okay.
And so in the larger bag, if you get stuck in traffic, you'll appreciate versus a small bag that now you're stuck in traffic. And what do I do with a full bag?
That's a,
Got back to the house
but
and
Dennis, but before you
yeah,
go into the actual
yeah.
recovery, going back to the house, one quick question. With the bag, do they allow you to choose at the hospital size of the bag or?
What they do is they give you two bags. One is an overnight bag,
Right.
and the other is a leg bag.
Okay.
And so one of the things I thought was, well, what do I do with this when I get home? And
Right.
I'll get into that a little bit too. And so I got back to the house and with the leg bag on, going, thank goodness I made it. And was able to empty the bag when I got here. And then I said, well, we live in a 2-story house, colonial. Now what? The bedrooms are upstairs. So I was able to walk up the stairs, which shocked me. And I thought, well, that wasn't too bad. But what I did notice is that I had difficulty laying down in bed because when they do the surgery, it's across your stomach. So laying in bed that first night was not a good idea. So I came back downstairs and actually slept in a recliner. And the following night, I was able to lay down. And then the object of what do I do with this bag came up. And so what I did is I put 2 pillows next to me on the opposite side and then put the bag down on the floor in a bucket and said, let's hope this works. And it did. And I woke up the next morning in the same position. So
Oh,
that worked rather well. And so, and then it was a matter of everybody saying, well, you can't eat until you start passing gas. So start moving. And
mm,
so I walked down the end of our driveway. I think our driveway is about 150 feet long. So I walked down the driveway and came back up a couple of times. And after a couple of days, more and more gas was being passed. And they said, well, you can start to eat food. And so I was then able to move away from the applesauce and chicken soup and actually have something that was a little more eggs and what have you. So it
right.
started to
Some
work and
solids.
the whole
Yeah.
process started. Yeah.
Wow. Well, you covered a lot there. I'm really happy with the way you described it, just because these are the details that matter, like the bag size, backflow, depending on how long your drive is home. Um,
Exactly.
the passing gas I've heard of as well, like needing to make sure that things are moving along before you start putting solids in.
Correct.
And you mentioned, I want to go a little more into the recovery. I know it must have, I mean, was it painful to walk? Sounds like you had a traditional surgery. I know some people opt for robotic surgery.
I had robotic surgery,
You did. Okay.
but there are 5 cuts that are made across your stomach. And of course, they're going through the stomach muscle. And while it was not unreasonable, I knew I had surgery. And it was just that first night. The second night, I was fine and had very little pain. The catheter came out 10 days later, and they want to make sure that you have equipment with you to take care of that because you will leak after surgery. And I didn't really have urine control for about, I would say, 3 months. After a 3-month period, I started to be dry at night.
Mm.
And then slowly I started to get dry during the day. And then finally, about at the 6-month mark, I found that I was dry and able to be in pretty good shape. And also, they had encouraged us to do Kegel exercises, which are exercises for your bladder, those bladder muscles, uh, pelvic floor muscles. And that helped dramatically. And I was pretty religious about doing them and also very religious about not overdoing them. Because I've had a couple of guys that we've talked to who say, well, if I can do 10 at a time, why don't I do 20? And rather than doing it 4 times, let's do it 10 times. And what happens is you over exercise the muscle. And what happens is you have more leakage. So you really screw yourself up by over exercising.
So just take it easy, do what the recommended number
What the
and
doctor tells
said.
you. Yeah. And it's so hard for guys to do that. We know much better than they do.
Right, right. Sounds like you were really good about that, though. You sort of stuck to that, and you found that it did get better. The catheter. Any last thing you want to say about that? I know sometimes people balk at the thought of having to deal with the catheter at home as well.
The catheter is how do I put this bluntly? It's a pain in the ass, to be blunt. But if you are careful with it, some guys get some irritations. You can put some Neosporin, that type of thing, where the catheter is inserted. But I think it's cleanliness. The biggest thing is to make sure that anytime you're touching any of the connectors, that your hands are spotless,
Right.
washed, and that you also really use some type of an alcohol swab on all the connectors so
Mhm.
that there's no danger of infection. A
Right.
friend of mine actually had an infection and wound up keeping the catheter in for almost a month.
Oof.
So it's much better to get it taken care of. And for the 10 days after surgery, be a nutcase in terms of cleanliness and using alcohol wipes on everything.
Right, right. Better to be safe than to risk all that headache.
Absolutely,
Yeah.
absolutely.
As we
And
wrap,
let me just add one thing. A lot of guys are concerned about the catheter coming out, and I will say that it comes out very quickly. There's a small bulb inside that inflates. When you go in, they deflate that, and the catheter just slides out. You don't even know it came out.
that's
So
great
don't be
news.
afraid of it, guys.
That's the best part. It's the
Yeah.
liberation, right? Okay.
Yes.
Freedom. So you did a beautiful job, Dennis, explaining all those details. With the recovery, what was then the follow-up? So was it like, okay, we're just going to take certain tests to make sure that things are good? What was that like?
Well, the recovery basically, after the catheter came out, I think it was several weeks, they had me come back in for just a general checkup, also for a PSA test. So it's a blood test. And they said, okay, you're looking good at 0.01. So fine. And then we kept doing that. So it was every 3 months, that it was 6 months. And I kept on a 6 month schedule. And very slowly over the next year, it got to 1 year. And then at that particular point in time, my PSA started to slowly rise from
Mhm.
a 0.01 to a 0.02. No alarms yet. That it got to 0.03. And the doctor said, we may want to watch this.
Mm.
So that went from 2014 to 2018 with a slowly rising PSA.
Dennis, before we go into finding the next news out, when the doctor said, hey, we might want to watch this, mentally, were you able to process that? Were you nervous?
No, no. You think to yourself, because, doctors do great things. They say to you things like, we got everything you cured. And I think the biggest concern, and I've heard this a number of times, when when you have cancer, you're not cured, you're in remission.
Right.
And I think if physicians and if I think if patients could also realize that when someone says to you, you're cured, translate that in English to you're in remission for now. Let's see how long this lasts. And it may last a long time. It may not last a long time. So I think it's a fault. I think doctors are anxious to have you feel better emotionally.
Right.
And I mean, candidly, after the surgery, within 6 weeks after, within 5 weeks after the catheter was removed, I was back riding a bike 25 miles a day.
Wow.
And 2 weeks after that, I was back kayaking. So picking up a kayak and putting it on top of a car and kayaking, not a problem. So my recovery was fast, but it's anytime too you're diagnosed with cancer, in the back of your head, you say it's still there. And I think it's always a worry about a reoccurrence, and especially with a high Gleason score. And a high Gleason score is anything 7 and above. And so guys will say, well, it's only a 7. Well, yeah, my neighbor across the street had a 7, had the surgery. Just after the surgery, came back in, they said, you need radiation and Lupron. Almost within, I would say, a month and a half after. It was like, okay, fine, we got to get you back in.
Mm.
So don't go by numbers. You have to really go on a case-by-case basis.
Right.
And everybody's an individual, and that's basically how you have to look at it.
I'm so glad you pointed that out, because we get these stories, but we also understand no two people have the same, experience or track the same.
I,
And for
I always say that prostate cancer is like a fingerprint. They're
Mhm.
unique. It's how it impacts you is unique to every one of us.
Right.
And the other side of this is prostate cancer is not a single disease.
Right.
There are many variations of prostate cancer and different types of it in effect. So it's something to be aware of.
Okay. And for you, besides the Gleason score, was there any other detail of what type you had?
Uh, no, I will say I never got that information, and I didn't know to get that at the particular time.
Okay. But
Because
maybe recommendation.
the recommendation is find out, and the other thing I would say to you is, to anybody listening, is sit down with your doctor and get as much of an explanation as you can. But more importantly, grab a copy of your medical record.
Yeah.
Grab a copy of anything that the doctor has notations on. Get copies of it, because put it in a file, because you may need it a year from now. You may need it 5 years from now. You may need it to sit down with a grandchild or a son or a daughter and talk about it, because the same genes that impact prostate cancer are the same genes that impact breast cancer.
Right. Right. I know we're getting more information about these connections too, which is
Absolutely.
promising. So Dennis, I know for you, you said it was these checkups, the follow-ups, the monitoring of the slowly rising PSA levels until January 2018 is when was that officially when, do you remember like a time when the doctor sat you down and said, you have it again? Or what was that moment?
Well, I was watching the numbers rise, and at the time, the guidance was before your PSA gets to 0 point, I'm trying to think, 0.2 is probably when you want to do something. Now, today, the number is 0.1. So as my numbers started increasing, it got to 0.0, let's say 0. It's getting my zeros mixed up here. 0.0, no, I'm sorry, 0.13 is what it got to. So it was, the next step would have been a 0.567 and then finally go to a 2. So at 0.13, I said, okay, that's it. And that was the number I had in my head. And then I said to them, okay, fine, let's start to look at this and get something accomplished. And that's when I met with my radiation oncologist. And that scared the bejesus out of me, because now you're sitting there going, here's this guy who wants to microwave my insides. And it was kind of like, do we really need to do this? And then we started talking about Lupron. And I go, what's Lupron? He said, well, that's a hormone shot that will decrease your male testosterone levels and probably make the thing more effective for you. And I said, that's great. And how long does that shot last? Well, we have a 1-month shot, a 3-month shot, and a 6-month shot. So in the back of your head, being a guy, what do you say? Well, that's it. It's the 1-month shot, right? No. So I go in and I see my urologist who gave me the shot. He said, well, this is the 6-month shot. And whack, I got the 6-month shot. The 6-month shot lasted 14 months.
Oh.
Yeah, it lasted a long time with me. I went through with that and found that I was having depression. I was having hot flashes. I was having night sweats. I would break out in tears for no reason at all.
Right.
And I would be shaking cold 1 minute and hot the next minute. And of course, when I said I had night sweats, my wife just looked at me and said, yep. Yeah, I know about hot flashes, dear. Now you know.
Right.
No woman on the planet was sympathetic to me at all. Oh yeah, hot flashes. Yeah, good. Now you know what it feels like. But that went on for quite some time. Muscle weakness. The other thing with that is I gained a tremendous amount of weight. I went from 165 pounds, I was 190.
Wow.
And that was within a 5-month period of time. And I really had to watch what I was eating and what I was doing. And they said, once the Lupron wears out of your system, you'll start to lose weight. And I did start to lose weight at about 14 months.
Okay. All right. And
the good news is you don't need deodorant while you have the shot, because everything is shut down.
I love that you look for the silver linings, Dennis, always.
Well, I actually read it from somebody else. The fellow said, you don't need to use deodorant when you're on this. And I thought, sure. And I tried it one day and said, hey, son of a gun, you don't need to use deodorant. So I looked at all the money I saved on deodorant.
Wow. A nice life hack there. I love it.
I'll tell you.
So the Lupron shots, did they say how long you would need it? Was it just the, one shot? And also, how did they decipher why Dennis needed the 6-month shot and why someone else might get the 1 month?
Well, I think they try to, I think if they're going to give you shots on an ongoing basis, they probably use the 1 month or 3-month shot. This was supposed to be a one-time shot that would activate in your system. Now, radiation itself, which I did not know, is not an immediate treatment. It takes anywhere from 18 to 24 months for it to work. So the idea of the Lupron is it sits in your system, helping the radiation to be more effective in terms of killing off the cancer. So, and it takes, prostate cancer divides very slowly. So what you want to be able to do is, as it tries to divide, the Lupron is making it weak, and the radiation is saying, you don't want to reproduce anymore, you want to go away.
Gotcha. Sending those right signals. And so for you, what was the timing of your radiation sessions and the Lupron shot?
Well, the radiation started, it was an 8-week course. It was 5 days a week. And, when you first start, it's depressing. You walk in there, and the first time you go in, they put you down on a table and they line everything up to figure out where they're going to fire the radiation at you. You get 3 tattoos so that they have targets to line up with. And then they put you in a body cast that holds you in place. So then you leave there going, my God in heaven, what am I into? And then about 2 weeks later, the doctor comes back and says, okay, we have our plan of attack all set. And you go in, and the first time I went in, I was really sweating it. And they said, well, lay down on the table. And literally within like 3 minutes, it was over. And it was like, is that it? You got to be kidding me. And so the radiation itself was really nothing. The thing that they would that was disconcerting at first. Is they said you have to have a full bladder. Well, of course, what does a full bladder mean? How full is full? So you're trying to lay on a table and be still with a full bladder, which is exciting to do. And after a while, I realized that a full bladder didn't have to be overflowing full bladder. It could
Mm.
be partially filled, because the technician can also look through the system and see how full you are, and then also move your body to do what he needs to do or what they need to do. So I realized after a while that if you were 3/4 full, let's say, you were in pretty good shape, and they
Yeah.
were happy with it. If you weren't, they'd chase you out and say, go have a cup of coffee.
Mm.
And so you had a cup of coffee, came back in. And I
Okay.
discovered that only after interesting situation. I was at the center to be radiated, and they lost power.
Oh.
And so they had to restart the machine, which took 3 hours. So having a full bladder for 3 hours was not going to work. And they said to me, this is how we do this. And then it was like, oh, okay. So I would suggest to anyone, when they say to you, if you're going for radiation for prostate cancer, they say a full bladder, be reasonable, and, you should be all right, versus trying to overdo it.
Right. That's another great tip, actually. That'll probably come in handy for a lot of folks who hear full. I mean, if I hear full bladder, that's what I'm thinking too. I'm thinking
Right.
let's guzzle down as much water as possible. So you had essentially 40 days of these radiation sessions. If it was over 8 weeks and it was 5 days a week, but the radiation sessions were pretty quick. Did you feel any side effects after the radiation?
A little bit tired, but I really felt nothing. What amazed me is I would go in, get back in my car. My car was still warm. So I mean, that gives you an idea in the middle of winter. So it was not a problem. It was in and out, and my neighbor went through the same thing and said the same thing. He said,
Okay.
in and out like nothing.
Good.
And so it worked pretty well. There are some people who have trouble with it. I did have some issues with hemorrhoids, because that can irritate that area,
Right.
and the application of some cream, and that seemed to go away pretty well.
Okay, so it wasn't too bad. It wasn't too
No,
severe of
not
a
at
case,
all.
just some
Right.
over-the-counter cream. And okay, so the radiation, just to be very clear, so was the Lupron shot first before you started the radiation?
Lupron shot was 3 weeks in advance,
Okay,
so it got into your system,
got it.
and then they started the radiation.
Got it. Okay, thank you for that. I might have missed that. You know, the as we wrap up this section about the treatment, Dennis, I know the 6 month shot ended up being 14 months in terms of what you were feeling, right? You could
Right.
feel the effects. Do you have any more guidance? You already spoke a lot of it, but just tips for other men on what they should expect or what might help relieve some of these symptoms?
Well, it's funny. There are guys in our support group who have had Lupron and said, "Huh, nothing happened. I didn't feel a thing." There's other guys who have gone through it and said, I had the same reactions you did. I had all kinds of issues. So I think a couple of things. Exercise, God forbid, helps. And so many guys don't want to do exercise. But I think if you can get out, get fresh air, and what I really suggest more than anything else is get out and walk. If you can do nothing else, walk.
Right.
And getting out into nature, getting some fresh air, changing your environment, and getting yourself out of the house. I think if you focus on the radiation, and you're going to have more problems with it. I think if you focus on your hot flashes. The one thing I did find very helpful was I got a one of these small fans that you see women use for hot flashes, and I got one that was filled that you could put water in,
Right.
and the combination of the evaporation of the water on your face plus the uh, the fan helped, particularly in the summertime when it's 90 degrees outside and you have a hot flash. A fan doesn't work, but when you put some water in there and have the evaporation, it does help a lot. But I think the key with it all is to just keep moving and keep active with it. And that's the best advice I can offer.
Great. And that's great advice. My last question is, how's the follow-up been since?
So far, so good. My PSA continues to be at a 0.02. And so hopefully it stays there. And my next appointment now will be in April, and I'll go back to see the radiation oncologist and see what those numbers look like. But as you know, and as we'll discuss later at some point, currently had been going through some chemotherapy. So whatever may have been coming back in my system for prostate cancer probably was being held under control also by chemotherapy. So we'll talk about that at another time.
Yeah, and just so people know who are watching, I mean, Dennis was also diagnosed with non-Hodgkin's lymphoma. You've just had everything under the sun happen to you, Dennis, and hopefully we'll be able to get into that story at another time, as you said. But that is interesting to think about how another treatment, of course, is going to be impacting the follow-up or the numbers for the first cancer you were dealing with.
Sure.
Okay, so our last video is also, as I mentioned earlier, my favorite. Dennis does so much work, and it's clear, I think, in the interview so far that we've done, that Dennis, you talk so often with people and you help many patients and caregivers. So hang tight as we go into the last section where Dennis will share his reflections. Great.